So before turning my duties over to Patrick Kelly, who's going to chair the last session, I just want to say thank you to all who have contributed in advance of the workshop and these 2 days. I very much appreciate it. Pat.
Thank you, Sheila. I'm Patrick Kelly here at the National Academies and the Institute of Medicine. I direct the Board on Global Health and the Board on African Science Academy Development. Jim described this field as in its adolescence, and that's more than a figure of speech. I first met Jim when I came to the IOM 12 years ago, and at that time, Don Berwick was on my board, and we started these discussions. And as it is when you have something embryonic, it's hard to know exactly where the discussions are going to go. But now we are literally on the verge of adolescence, and so I think we have much more of a sense of where we should go. And I wanted to just thank everybody who participated in the meeting yesterday and today, because this has really, I think, matured our ideas a lot more on the type of work that we should be pursuing. When Don and Jim and shortly thereafter Sheila joined our board, we continued these discussions with some support from AHRQ. But a lot has changed over the 12 years. You know, we've had PEPFAR, a tremendous investment in the provision of health care in developing countries. We've had the President's Malaria Initiative. We've had this huge movement toward greater focus on non-communicable disease control. The Ebola problem has shown us the importance of health system strengthening and quality of public health care. So all of these different things have, over the last 12 years, I think, shown us that this is an area that we really need to focus on now. When we started 12 years ago, it was in the wake of the IOM's domestically oriented quality of care work. And it was a little bit challenging to bridge the gap between the domestic focus, which was a signal achievement, but it was built on an established foundation of accreditation and licensure and things like that. Moving to the international arena, we couldn't make a lot of assumptions that you could make domestically around things like I said, like around food and drug safety, that kind of thing. So I'm looking forward to continuing to work with all of you so that we can take the ideas forward from here, so that we can develop a more systematic approach to creating a multi-dimensional agenda for advancing global quality of care, one that will serve the interests of people who need access to care. And we talk about the right to health care, and we kind of assume that it's good health care, but as we heard from Ashish Jha the first day, there's an awful lot of care out there that's you wouldn't want universal access to. So we really need to focus on addressing that. I don't want to take up too much more time now because you have two more experienced speakers than me. To my immediate right is our president of the Institute of Medicine, Dr. Victor Dzau. Dr. Dzau is internationally known for work on academic health care. He came to us after about 8 years as the executive at Duke University for all health-related activities, academic and service delivery. In the course of that work, he worked to establish the Singapore Duke National Medical School, is consulted in other foreign countries, and I'm very, very happy that he is here with us because he brings a valuable international perspective and health systems perspective, and I think is the right person to guide me and my board at this moment as we move this child into adolescence. Thank you.
Thank you, Patrick. I want to start also by thanking a whole number of people. First, Sheila, a wonderful job you've done the last 2 days. You deserve a round of applause. Because Jillian, I mean, her organization is still getting everything going. We truly appreciate it. And of course, Patrick, I think first at IOM, we're very lucky to have someone like Patrick. You heard the 12 years of activities and how in many ways we've worked with many of you to improve, the health status globally. And we're very privileged to be part of this. And of course, I'm going to introduce Don Berg in a few minutes. So I'm not giving a talk. I'm just giving you some reflections and what I've heard for the time I participate in this meeting and also what I'm aware of, and to say how important the work you're doing. Certainly, I feel that there's tremendous knowledge, experience, and enthusiasm in this room. And I think everybody recognizes the need for strengthening health systems globally. Today, you talked about not only having a system, but a system of quality and safety, which is obviously critically important. When I look back on this whole issue of developing economies, low-income countries, low-middle-income countries, for a long time at least, the people I talk to are all about access and cost. You can have access to care, you're going to have to make it affordable. And so pouring money into creating the access and having the systems is where a lot of focus has been. But, listening to Jim, and I want to thank Jim as well for his great support. It's been 10, 15 years that people are also saying, what about the care that we're getting? Is this the right quality? And how do we improve, the quality of care, the QI issue? I think this is so right on. Because as I reflect back on my own experience, certainly for us in US, we always remember the Quality Chasm series. Don Berwick played a very important role, as does others, in waking us up to say, yeah, you spend a lot of money in care, but do we have evidence that it's making a difference? Do we have evidence it's providing quality? And surprisingly, it's not even safe, as you heard yesterday from Ashish Jha as well. And that, I think, has transformed our country tremendously. I'm not saying that we're perfect, but I'm saying that it's changed it, because as someone who's the CEO of a health system at Duke and the chancellor at Duke, I would tell you our own experience in patient safety and quality and the influence on the quality chasm has drove us to change ourselves tremendously. Things are so different. So I think the question that has to be raised is, can that experience in US be easily transferred to elsewhere? And you heard Patrick to say, yeah, there's a lot of lessons learned, the 6 different aims of safe, effective, patient-centered, timeliness, efficiency, and equitable, I think applies to everywhere. However, as I've, talked at this recent conference, there are many things which are globally informed but locally specific. And when you think about how you want to apply these, they may be quite different. And certainly there's a bigger framework about what exactly is quality in the global health context. So I'm quite convinced in talking to Don and Sheila and Patrick that IOM should put its weight behind this, that should really put some serious effort into thinking about how to create that quality chasm issue globally. And I would tell you that we're quite prepared to find ways to work with you to advance this very important area. And also, I can't think of a better person than certainly the next speaker, Don Berwick, and together with Sheila. I guess they have actually put this on the agenda for quite a while. And I think time is, as you say, you're going from adolescence now to the right time to move forward. But let me therefore just simply say that it's been a great privilege for me to be part of this conversation. I get it. It's really important. And the conversation about policy, about practice, about research resonates so well in many of the things I see that we need in this country and elsewhere. So without further delay, so I'd like to go ahead and introduce our next speaker, who, of course, doesn't need any introduction, Don Berwick. We all know him for his tremendous leadership and his whole life's passion in improving quality of care, his unwavering commitment to good health care to people in all corners of the nation and beyond. I remember when I first met Don, in fact, I was in Boston. And of course, Don's work was really, and IHI is really well known. I was at Partners Healthcare at the time as chair of medicine at Harvard and Brigham and Women's Hospital, and Don came to speak at Partners Retreat. Don pulled no punches. He didn't spare our feelings. He told us what we were not doing wrong, or we're doing wrong, but we're not doing right, and he was so right. And for an organization of Mass General, Brigham, and Harvard, we thought everything we do was great, because we learned that so many things we've done that we can do better. So he's left, for me, an indelible memory for me, impression about someone who's passionate, who cares what he does, and who's able to use his intelligence, experience, and all his other leadership ability to move this agenda forward. Many of you know he is now a President Emeritus and Senior Fellow at IHI, but of course we also know him as the former administrator of CMS. I was just telling him, in the short time he was at CMS, he's made a lot of difference. I can tell you personally, and we appreciate it. And the innovation that he's brought to the table and pushing us forward to do things differently. Certainly for me, I think about myself as an innovator, and I truly appreciate it. Also, we're very lucky that he is a IOM member, and now with this maybe a little free time, we're going to keep him very busy to help us advance our agenda. So without further ado, let me please introduce Don Berwick. Don.